How you doing?
I'm well. How are you? Let me get centered here.
I'm well, yeah, get comfortable. Get comfortable. Welcome to Take 10. Thanks for joining us.
Well, thank you for having me.
I think I just connected someone else. I thought I was connecting you, but we got someone else who was still lying in bed in the morning, I think.
Well, that is my worst fear, the fear that I'm going to be connected in my pajamas. So,
Yeah. You did well. Welcome. Thanks so much for taking the time out. This must be an incredibly busy time for you, for your colleagues, for your organisation. Before we even get into that, on a personal level, are you healthy and well?
I am. I am
Good.
doing my best. I was listening to you, even though we weren't connected.
Yeah.
But I do get up in the morning, and before I do anything else, I try to get centered, right?
Yeah.
And just take 5 minutes before I pick up my phone to start answering my email. So I think that's
Yeah.
very important. So I am well. I have to say
Yeah.
that I miss my dad.
Yeah, I bet.
My dad lives not too far in a senior apartment complex. He's doing fine, but I, of course, he's 86, and I have not been able to speak with him. But I'm doing well, and it's such a privilege every day to be able to represent the physicians of this country, but really the physicians in the interest of serving our patients. So it's an honor and a privilege, and an honor and a privilege to be here with you. And
Yeah.
thank you for what you're doing. And we love our partnership with Headspace.
Thanks, Patrice. Yeah, and then we'll talk about it. But I want to come back to your dad a minute because I think this is something that lots of us are in this situation. Maybe elderly parents, they may be living on their own, they may be living in care homes. We can't necessarily visit, and a lot of them, unfortunately, don't necessarily have the dexterity or the ability to connect through FaceTime. For sure, they're not tuning in on IGTV. Kind of, do you have any kind of way of maintaining? Are you able to drop notes off or letters off or anything like that to maintain some kind of contact?
Well, we chat every day.
Oh, you do?
And
Okay.
so yes, no,
That's
we,
nice.
we we chat every day, and he actually is more worried about me
I'm
than,
sure.
than I am about him. But yes, I am able
Okay.
to connect, and that's another thing I think we should all remember. I purposefully, and others have been doing this, use the term physical distancing
Yeah.
instead of social
Yeah.
distancing, because we want to make sure that folks, words matter. As I've said for many
Yeah.
years, words matter, and
Yeah.
so we still want to maintain that social connection.
Yeah. And look, you're I should say as well up front, your training, right? Your area of expertise is psychiatry.
That's correct. Yes.
So when it comes to the mental impact or the impact on our mental and emotional health of what's happening right now, that must be at the forefront of your mind. I don't know if you're still able to, are you still able to see patients kind of possibly remotely? How's that working?
Well, certainly seeing patients remotely is one of the things that all physicians are able to do during this time.
Excuse me.
Because as you might imagine, because my schedule is so unpredictable,
Yeah,
and there have been lots of media opportunities so I
I
can
bet.
get out the word. And I would hate to have to suddenly cancel a patient,
Yeah,
because of these other obligations. So at this moment, I'm still consulting with a couple of the agencies where I saw patients, but
yeah.
no direct seeing my
Okay.
patients. Yeah.
What about in terms, so if not with patients, what about with your colleagues and with the people that you represent, the healthcare professionals of America? Like, what are you hearing from them? Obviously, we get one. Well, I suppose there are multiple viewpoints from different media outlets, but what are you hearing directly from them as to what their experience is and how they might be kind of coping with the stress of the situation?
Well, I do get the privilege of hearing from my colleagues, either personal emails or text or phone calls, certainly over social media. And I think a couple of words. One is resolve. Let's just
Yeah,
start there. As I've said in other fora, physicians don't run away from problems. We run towards them. You know, that is sort of why we went into this. However, this is an unusual circumstance, to say the least, and to state the obvious. And physicians are exhausted. Those on the front lines are exhausted. Physicians are worried. Those on the front lines are worried about, more so, I think, taking care of making sure they don't go home and infect and expose family members more so than themselves, you know? And so they're worried. And of course, we've talked about the importance of making sure that physicians have the equipment that they need. You know, physicians are doing things like writing their wills, you know,
I see
and those stories, and they are away from their families. Those, and I will make this point, those who have the privilege of being able to maybe stay at a hotel or somewhere else. And we have to think about that. Not everyone has these privileges.
Absolutely.
And that's something we should all remember, but they're away from family. So, but everyone is working, and even physicians who are not on the front lines are still figuring out ways to make sure patients get their needs met. So it's exhaustion, worry, but resolve. You know, or you may know that we were already sort of pre-COVID-19 dealing with the significant amounts of physician burnouts. And so now we have this on top. So we will have to be ready immediately when we get to the point where we can breathe, when we can take our collective breaths. We're going to have to be ready to all hands on deck and help everyone, not just physicians, but this nation heal and be there to support their emotional and psychological and mental needs.
I was going to ask you about that because, you know, part of the reason we have this partnership together is because I think over here you call it burnout. In the UK, it's often referred to as compassion fatigue. But people working in the medical profession who are working, you say, such long hours and often in such difficult circumstances that they don't have time to take care of themselves, and their own health suffers as a result. That was already, as you say, a kind of a really sort of dangerous level in many hospitals. Kind of what's the long-term approach to that? Because as you say, this will only compound that. And even if we just go back to status quo as to where we were before the pandemic, even that wasn't kind of really working in a healthy way. What's your long-term vision for how doctors, nurses, healthcare professionals can stay healthy and well physically, mentally, emotionally, kind of whilst continuing to do that important work?
Well, first, I think, and you make an important point about status quo. And so I've been saying there will be a new status quo. There will be a new normal. Now, in some ways, I think there are great opportunities. Whenever there's a new normal or a new situation, there will be great opportunities to improve upon the old normal, you know, the old status quo. And certainly we will need to be ready to do that. One of the things that the AMA is focused on regarding burnouts is the systemic issues. You know, the conversation originally was almost, and I'll use this term, sort of heal yourself, you know, physician heal thyself. If you just sleep more, if you just eat more vegetables, and being a little bit reductionist there. But we know that it really is about the external factors that needed to change. And so we've been working a lot on the external factors, and that will need to be a focus of our work going forward. We will have to work on what were the external factors that were causing burnout, stress, mental health. We all know, speaking again broader than physicians, we in this country have really underfunded our mental health system for so many years. And so there are going to be acute needs, as you said, on top of the baseline needs before COVID-19. So we are really going to have to step up our efforts in that area.
What, for those people who are tuning in today, and for myself, what can we all do? And look, I know there's obviously the advice to sort of stay at home, to wash our hands, but from somebody working within that profession, What's your advice to all of us? How can we best help you and your colleagues kind of move through this?
I love that question, and my answer is very simple. And I think people may not realize how their own individual actions impact everyone and ultimately impact the physicians on the front line. So if everyone sort of stays at home, right?
Yeah.
Follows the physical distancing recommendations of their state and local health departments, what they're doing is certainly protecting themselves and their immediate family.
Yeah.
But they are protecting everyone, because here's the linear thinking on that. If I stay home and if I go out, let me just do what we shouldn't do. If I go out and there's potential for me to infect others, others to infect me, all of us to infect others, we increase the numbers. We increase the risk of then overwhelming the healthcare system. Which means we are putting all of those workers on the front lines in danger. And I also want to give a shout out here to, of course, physicians and nurses and the respiratory therapists, but even those food service workers and those who clean our facilities. So it sounds simple and it may not connect, but I want people to know that just by staying home and following the physical distancing guidelines, you can help us on the front line.
Yeah, that's all, and it's great. It's always good to hear it direct from the source, and it reminds me, between us as sort of friends, we've been talking sort of over the last few days, and you know, one thing, and I'm not going to hold you to this or put you on the spot, but you know, when there's a lot of talk, especially sort of within politics, of okay, kind of this is the peak date. Once we move past the peak, and almost as though they're trying to sort of put a finish line, like a date, so when everything will be okay again. I'm no medical expert, clearly, but it seems to me that that's not how it works, and that this is something that isn't just going to finish, and that there will have to be some kind of transition period. When you look at that with your colleagues, are you expecting, is it an idea of sort of going through it in waves that have been talked about, kind of where we will go into lockdown, we come back out, we see kind of what happens, then perhaps we have to go back into lockdown? Or is the idea sort of more that we actually change and modify our behavior, and actually it will take a number of months, perhaps even longer, before we can return to life maybe as we knew it before?
So I think the first thing to say is we can only predict what we will experience going forward regarding the peaks and when we have the data that we need. And so a part of that data is, the number of hospitalizations and the number of deaths, and the number of positive cases. And of course, we will need testing. And then when we get all that data, those experts, I am not an expert in modeling. And let's just all remember this, models are never 100, and they're not meant to be predictive. You know what I mean? Necessary. Yes, this is the right model and we can predict the date. They're meant to give all of us some data as to when we might expect the next, the plateau. But to your point, I do not think, and in fact, I don't think any of the experts think that it's going to be on and then off. There will be a gradual slowing. Everyone's talked about flattening of the curve. Why was flattening of the curve important? Because what we didn't want to do was overwhelm our health system at once. So again, even others have said we may end up getting the same numbers as the number of hospitalizations, for instance, but it would be better if we got those numbers over a longer course of time. We wouldn't overwhelm the health system. So I think people should prepare for gradual slowing of the curve, and then the experts who have the data, hopefully good data and modeling, will help us all understand what we can return to. It will probably be a gradual return to that new normal, and we do have to make sure that we don't say, all right, all clear. I don't think there's going to be an all clear moment, but there will be moments where we get back, and then we have to stay vigilant for those waves, as you noted.
Well, look, we're going to do, if it's all right with you, we're going to do a short little exercise in a moment. The idea of this is that everyone kind of gets to come together, remind each other of the importance of taking a little bit of time kind of out of our day. Before we do, I do just want to say thank you. I think on behalf of everybody kind of tuning in today for the work that you're doing, your colleagues are doing. I said before you came on today, I don't know if you were there at the very start, but it's just incredible to see the outpouring of appreciation for everybody kind of working in healthcare. Really emotional. I don't know if you have just a particular story or something in mind that's touched you when you look at your colleagues who are working on the front line. It doesn't have to be a particular situation, but something that leaves you, even in this really sort of difficult sort of time, something that lifts you up, something that inspires you, and something that you can sort of come back to keep you going.
Well, I have to tell you that I do often find myself in tears.
Yeah, I'm sure.
During this time, and that's okay. One of the things I want to make sure is everyone sort of expects to have these feelings and allow yourself to experience whatever feelings you're feeling. Yeah. But so two things to come to mind. I think a couple of stories about my colleagues on the front line. And realizing, and some of my colleagues saying, and probably because I could relate with my dad, that they haven't seen their children in weeks.
Yeah.
But the other thing, and of course this, I believe, started in Italy, but I live in Atlanta. Yeah. And the day I saw that everyone in Atlanta at 7 o'clock went outside on their balconies and just cheered for health care workers and frontline healthcare workers, that also was very meaningful and emotional to me. So those are just two instances. And I want to say that for physicians, definitely, but really for everyone, remember what they say when, again, those of us who have the privilege sometimes of even flying on an airplane, put your own mask on first before helping others. So that's what we all have to remember.
Yeah, well, all of that show of appreciation, I think, is very, very richly deserved. And thank you again for all you're doing. We're going to do a short little exercise. Okay. We did it. It's the same one that we did a couple of days ago, for those of you tuning in. So it's a way of, on the one hand, grounding ourselves and focusing on the breath, being less distracted, and at the same time, staying connected to the people we love. So before we begin the exercise, Patrice, for you, it might be your dad, it might be somebody else. Think of somebody who you can't necessarily be with right now, but you would like them to feel healthy, you'd like them to feel happy. I know last time we did this, lots of you were messaging saying that you were crying, and that's fine. As Patrice said just now, I think that's part of the experience. It's part of being human. It's part of what we're going through right now. Don't feel like you're doing anything wrong if you feel sad. In fact, it's really important to allow that stuff to come to the surface and be present in the mind. So, Patrice, for you, it's entirely up to you. You can turn your camera off. You can stay sitting there. You can go and lie down on the sofa and leave your camera on. Whatever feels more relaxing, please feel free. If you're at home, make yourself comfortable. You can do this sitting down, lying down. But we're going to start in the usual way. So rather than closing the eyes straight away, we're going to start with the eyes open. And just taking in that space around you. So it just helps maintain that sort of soft focus, and it sets up the mind in a very relaxed way. And we're just going to start with a big deep breath. So just this first breath, we're going to breathe in through the nose and out through the mouth. So as you breathe out, if you'd like to, you can gently close the eyes. If you prefer, you can keep them open. And just take a moment, as always, before you do anything else, just to feel the weight of the body pressing down. And just to appreciate that moment of having stopped, having paused. Knowing that you might be on your own, but you're sitting right now with many, many people from all around the world. You're starting to notice how the body's feeling today. So any tension, discomfort, any heaviness. But also maybe noticing any feeling of ease, of lightness. So just using the opportunity to check in with how the body's feeling. And then just slowly starting to become aware of the breath. So no effort required, just noticing that rising and falling sensation of the breath. So we're going to use that as our anchor as we stay here, just for the next sort of 30 seconds or so. But at the same time, I'd like you to bring to mind someone who you care about. And I'd like you to picture them in a place that you know they enjoy, a place you know makes them happy. It might be a particular location, it might be a particular chair, it doesn't matter, just somewhere you know they feel at ease. When we stay with the breath and with every out breath, we just picture that person looking increasingly relaxed. We see that person beginning to smile. You see that person looking increasingly at ease. So just staying with that movement of the breath, just for a couple more. And with each out breath, just enjoying that feeling of seeing the other person happy, seeing them well. And then just very gently bringing the attention back to the body. And back to that feeling of weight, but allowing that feeling to remain in the mind, that feeling of connection, perhaps feeling a little more calm, a little more clear. And then whenever you're ready, you can just gently open the eyes again. Okay. Patrice, thank you so much for joining us today. I hope personally that you, your family, your friends, your loved ones stay healthy and well. I hope that as an organisation you'll continue, you'll be able to continue to support healthcare professionals around the nation in a way that I know that you do. I know you care deeply about it, and just again, sort of heartfelt thanks to you and to all of your colleagues for everything you're doing. For those of you who are tuning in today, thanks for joining us for Take 10. We'll be back here tomorrow morning at 10 o'clock. And I heard last night, I can't promise anything, but next week, in the middle of the week, we might have, every guest is special. This particular guest, they're not human. So they're a little bit extra special. I'll have more to tell you in the next few days. But thanks again for joining, and have a wonderful day today. Thanks, Patrice.
Thank you for your support of physicians.
No worries. Thanks. Bye, everybody.